Good morning, everyone. Welcome to the latest series of my vlogs and sharing this kidney transplant experience. I hope you're enjoying um, these videos and they're helping you in some way. Today is Friday, January 17th, 2025. Almost one full week from my transplant, which took place last Saturday night. The time right now, it is about 5 minutes to 11 a.m. And I made some notes here that will help me with this video here. So I woke up this morning at 7:45 a.m. and first thing I have to do every day when I wake up, I have to weigh myself, get my temperature and blood pressure, and I have to log this information. I have an app, a good app I found. It's called the Blood Pressure My Diary app. Again, Blood Pressure My Diary app. It allows me to enter all this information and I can easily share it with the medical staff. It allows me to just enter their email address, send it to them in various formats like PDF or Excel file, a bunch of different formats. So it's a pretty neat app. And so you got to do that. And there's good news with this. My weight is falling down every day. My blood pressure is going down a little bit every day. And one thing that happened after the surgery is I gained 20 pounds. I gained 20 pounds. And that's a result of not doing daily dialysis and my kidney not being awake. Because it takes several weeks for a kidney to fully awake. And because the kidney I got sat in an ice chest for several hours, and that put the kidney to sleep. And so that's why I gained 20 pounds. And so over the last few days, let's see, I'll go through the weight. See, Tuesday I was 81.3 kilograms. The following day, 80.3. Following day, Thursday, 79.2. Then this morning, 77.9 kilograms. So I'm losing an average of 2 pounds per 24-hour period, which is excellent, and that's a result of the amount of urine I'm putting out. And I am putting out an exceptional amount of urine. And yesterday at my doctor appointment, I was instructed to drink 1.5 liters of water per day. And let's see, my urine output has been just off the chart. Okay, I have to keep track of that because my doctor wants to measure my water intake versus urine output. That is good information for her and allows her to see what is going on. And I also have to keep track. Sorry to be detailed, but I'm just trying to share as much. But they want me to keep track of the quality of my bowel movements, and because that's good information, the quality of it. So anyways, going back to my urine output, okay, beginning yesterday at 12 p.m. through 12:30 a.m. this morning, my urine output was 79 ounces. That is more than 2 quarts. And also, okay, now from 12:30 a.m. this morning through 10:45 a.m. this morning, my urine output was 68 ounces. Okay, 68 ounces. So that's just over 2 quarts of urine. And it's kind of hard because I literally have to wake up every hour during the night. The urge to urinate wakes me up. I have to get up and go urinate literally every hour, just on the dot. And during the day, it's a little bit less than that because I'm awake, so I'm not waiting till I have the extreme urge. And but that's good, aggravating, but good. And so I think my nurse will be very happy about that. And anyways, this morning, like I said, I woke up at 7:45 because it's important that I take my first round of meds at 8 a.m., which I did. This morning, I felt light nausea, but after my breakfast, which was my coffee, 4 hard-boiled eggs with an apple, I felt a little better. And I just had a little tub, a little container of yogurt, and I feel a little better. So, yeah, I think it's just being a little hungry, and because yesterday the nutritionist said that she would like to see me eat more, so I'm trying to do that. And I do feel a little tired, but hey, I woke up every freaking hour during the night. So, anyways, like I said, I'm approaching a full week, and one of the things I have to do is visually inspect the incision. So I pull off the brace and just visually look at it, check for any seepage, any bleeding, and so far so good. The incision is dry, looking good, healing well, still sore, but that is normal. And so I did dialysis once in the hospital, and that was it. And so, yeah, so, okay, I went over these notes here, and there's a few things, a lot of documentation the hospital gave me to take home. And this one here is just about the kidney transplant, what to expect. And it gives you like a visual of, here's the incision. They like to put the kidney on the right side, and so they illustrate that. And here's another picture. Now, usually they leave the original kidneys in the body normally, and that would be the new kidney. They just simply disconnect them, and they stay there, no problem. But in my case, which is not very often, they had to remove both of my kidneys. And so this is just documentation right here. They give this to you. I'll go through this one. This one is after kidney transplant. It talks about preventing rejection, treating rejection, possible side effects of medications, and so that's what this is. And this one here, these are my discharge orders, and basically it has a lot of information, scheduled appointments, discharge orders. Let's see, common emergency awareness tips, and so future lab orders, just a lot of information here. And it has a list of all my medications. So again, these are my discharge orders. And this one here, discharge instructions for hyperkalemia. See, it says you have been diagnosed with hyperkalemia. This means you have a high level of potassium in your blood. Potassium is important to the function of the nerve and muscle cells, including the cells of the heart. But a high level of potassium in the blood, serious problem. So diet changes. Eat less of these potassium-rich foods, bananas, apricots, oranges. So it gives a list of foods to stay away from to avoid the high potassium. So good information there. And here is a kidney transplant quick reference. And these are some points here, bullet points, what to watch for after transplant. If you have a fever, 101.5 or higher, that's an issue. The nausea, vomiting, or diarrhea, that's an issue. And right now, I don't feel nauseous. I think just eating made my light nausea go away, but I did document that. And so, blood and urine obviously is a big issue, and but you will have a lot of blood. There was a lot of blood in my urine the day after surgery, and then the second day there was less blood. It was pink. Then the third day it was almost clear, but now my blood is just perfect. It's perfect, and so I'm happy to report that. And like I said, new or active bleeding around the incision site. Like I said, it's important to visually remove this bandage every day and visually inspect. And so, and then severe pain, which fortunately I do not have. Again, I just have soreness. And so there's a other what to avoid after transplant. And now, when you get a transplant, I am at a higher risk of skin cancer. So using like suntan screen, or whatever do you call that, sun, like screen to put on my skin, that's going to be very important. And and definitely like cover up if I like do yard work or something. Won't wear a hat, perhaps long sleeve shirts to block direct sunlight on my skin. I do have to forever see a dermatologist once a year just to check everything. And we want to catch things early if I do have skin cancer. Not that I will, it's not a 100% chance, but we want to be safe and precautious. So I already have an appointment with the dermatologist 6 months from now, and then I will go once a year. So anyways, okay, my lifting restrictions has been increased. At first it was under 10 pounds. Now I can lift up to 15 pounds. So that's good. I have some dumbbells. I might do a little bit of light lifting, just kind of keep my shoulders looking good. Not looking good, but just kind of maintain a little bit. So I'll do various exercises, but just avoid doing, putting any pressure on the frontal side. So I can sit in a chair, do curls, and so I'll figure something out with that. And talks about how often I got to go to the clinic, and just various information about future clinic visits. So this is, like I said, a kidney transplant quick reference. And this next one, let's see, these are various issues someone might experience, such as abdominal bloating or gas, allergies, nasal and sinus congestion, sore throat, and they recommend what to use. And these are over-the-counter medications the patient is recommended to buy. So it goes on the back. Cough, chest congestion, constipation, diarrhea, minor aches, upset stomach. So yeah, so just a little guide here of over-the-counter meds to buy to deal with minor issues. So this next one, okay, there is a stent inside of me when they put the new kidney in, and I have an appointment later this month to remove stent removal appointment. So that's a simple outpatient procedure, and I will definitely make a video about that. Okay, now this list here, this page, I will always be kind of like low on magnesium. And so this is a list of high magnesium foods. Okay, so pumpkin seeds are very high in magnesium. 1 ounce, 151 milligrams of magnesium. That's the highest one. I've seen those little bags of pumpkin seeds like in 7-Elevens. So that might become a thing for me. And I've never had pumpkin seeds. I had pumpkin pie. So, but there's like nuts, almonds, or cashews. I like almonds and cashews, peanut butter, and so yeah, so good high magnesium foods, I guess. Okay, phosphorus content of foods. Um, Phosphorus is an important menu that your body uses for energy and overall health. And so this is just a 2-page thing here giving me information on phosphorus. And so this one, fine, just a one sheet, nutrition for wound healing. So it says, like, you know, what should I eat? And protein, 3 to 4 servings per day, carbohydrates, like that's rice, and so drink plenty of water. Well, 1.5 liters of water a day, that's pretty plenty. So that's what this is, and I'm gonna read through all this, you know, later on, and because obviously it's very important to me. There's a few like little like magazines that kind of like short magazines, but this one is what to expect after your kidney transplant. So nice colorful pages, and so I'll definitely read that. This one here is food safety. So for older adults, people with organ transplants and autoimmune diseases. So not very long, a little magazine here. I'll go through that. And this last one here, nutrition for a healthy heart. So I'll go through this, check it out, educate myself. And because keep in mind, taking care of a new kidney, a new organ is a lifelong thing. And here's this folder they gave me for everything. And so here's a copy of my med schedule. I've shown this on a previous video. Basically, it has all my medications listed, and it's just the front and back of one page with a half page. So, and here's my pill box. And so today is Friday morning. So I've already, see, this is empty. I took this at 8 o'clock this morning. There was about more than a dozen pills. The morning round, that's a lot. So anyways, let's see if I have anything else to share. That's pretty much it for this video. And I'll show you this t-shirt they gave me. Recycle life. This is my t-shirt. So anyways, but yeah, as I go through all this, I'm going to work on a short grocery list to give to my wife. And so other than that, so far so good. Like I said, a week out from my transplant. And the biggest complaint I had was, see, transplant was Saturday night, Sunday, Monday, Tuesday. I had a crazy hiccups, and I think maybe you've seen that in past videos. I mean, they were strong. I could not get rid of them, and so I'm happy to report that Wednesday, Thursday, which was yesterday, and so far no hiccups. So I'm very glad those are gone. And so that's really the only bad thing I experienced from the transplant, is just those damn hiccups. Good Lord, they were so intense. So anyways, okay, I'm coming up on the 20-minute mark. I don't like to make my videos that long. So I hope you enjoyed this video, and feel free to hit the bell if you want to be notified when I upload a new video. I like sharing this with you, and because there just wasn't much information on YouTube that I found going into this. So I hope this is helpful for you. Have a good day, and see you next time.